I want to talk for a couple of minutes about something that I hear so much of, and that's, should I be taking vitamin D? And why do I want to take vitamin D? And what kind of vitamin D should I be taking? So I have as my guest again, Dr. Kelly Miller. Dr. Kelly Miller.
How you doing? Good to see you again.
I love that name, by the way. It's an awesome name.
Good Irish name.
Irishman. So I hear so much about vitamin D. It's a vitamin. How important could it be? I mean, you know.
It's big, and the thing is that vitamin D is really not a vitamin, it's a hormone. And in fact, every cell in our body has a receptor site for vitamin D, so it's got to be very important. And we used to think, well, we're out in the sun, we don't have rickets anymore, which is a bone softening disease associated with vitamin D, so we don't need vitamin D. But there's been extensive research throughout the world, and it's so important if you're in the lowest quartile, which means the 25th percentile, for vitamin D, that you have an increased risk for all mortality. You're just cancers, heart disease, diabetes, kidney failure, depression, so all kinds of things. So it's very important.
So how do I know if I'm down that far? I mean, what do you do? You have to go get blood tests?
Yeah, the best way to do it, and we like, you can get in if you go to the doctor, sometimes they'll do it, but not. But we do it in our office, is a dried spot test. So you just get a little capillary blood from the finger here, you put it in a dot, and then you send that off the lab. And it's actually better than your blood because they use a gas spectromography, which is the state-of-the-art for analyzation, and you get a much accurate level. So,
really?
Just did, I moved to Tampa a few months ago from Kansas City, and we did, one of my patients who was on my radio show was the host, we did him, and he was at 26, and here he is living in Florida. So it's, if people in Florida, which is a sunshine state, which you get sun year-round, have vitamin D deficiency. So when we're up here in North Carolina, if you're basically past northern Texas, you're not going to get any sun.
Certainly going to.
Yeah, November to February, you're not getting any sun.
Well, and I think it's an important concept for people to realize, because people think, well, I have to go out in the sun, but the fact is, it has to be full body.
Right. Exactly, and you go out and you're just getting your face and your hands. So if we go out, you and I, similar complexion, if we go out and you just got a bathing suit on, and we're getting pretty much our legs and everything, maybe in 30 minutes we'll make 10,000 IUs of vitamin D, but we're busy, people don't do that anymore, so you're not getting it. So really the best way to do is just to supplement, because not only do we want to take a little vitamin, and the medical doctors are recognizing this, and they're doing this, but their recommendations many times are very small, 1,000 IUs. 1,000 IUs is not going to get you very far. So if that reference range now is 32 to 100, and it's a hormone, and like all other hormones, we know that if you're in that top 25 percentile, you function 300 or 400% better than that lower quartile. So my goal is I want to get my patients that 75 to 100 range, and that usually takes a little bit more supplementation. I personally take 20,000 units a day, and there's been no toxicity levels on vitamin D actually ever recorded. They've never made a lethal dose. I mean, there's certainly a limit you don't want to go to, but they've done tests up to 40,000 for a long period, and okay, so it's pretty well established 10,000. In fact, it's recommended now for any kind of chronic illness. If you had cancer, heart disease, or any autoimmune disease, lupus, MS, that you should get at least 10,000 IUs a day.
So this, you're talking about this spot check thing.
Dried spot test.
Fairly expensive.
No, not at all. $90. So it's very reasonable, I think, and most people can afford that. And I think kind of a bang for your buck. We were kind of talking before. I think getting your vitamin D levels optimum is one of the least expensive things you can do to improve your health potential, because it covers so many. It's anti-cancer, anti-heart disease, it's anti-depression. It's just about anti-everything. It helps the whole body function better.
So yeah, it's not just that you have a vitamin D deficiency. It is that your body is lacking something that's vital to it, that if you don't provide it, you're going to start breaking down.
Right, because that receptor site is there to be stimulated so it can function. Brain function, skin function, bone function, all of the body.
That's pretty important.
Very important.
Okay. So here's where you go. You just go here, have one of these, save up your $90 if you have to, and go get this done. I think it's that important. Don't go out to eat. Don't do some of the stuff that you want to do, and save up for this and get this thing done, because that's pretty important that you get it done. Dr. Miller, thanks you. Thanks you.
Thanks for having me.